Hello. The following video is a review of our database built for the fictional practice of East End primary care. I will start off just giving you a basic description of each of the forms that we have built. The first and main form is the patient information form. It includes the patient demographics, a checkbox indicating patient portal opt-in, and also our clinical decision support alert window. I'll review the clinical decision supports in just a few minutes. Please note that the gender and race fields are both drop-down boxes. This will allow us to use these in a query later on if we so choose. When I scroll down, we come to the first subform, which is visit information. Included in this form are the disease name, which is really just the reason for visit, the patient's smoking status, vital signs, height, weight, and BMI, and any visit notes the provider wishes to include. On this form, the BMI is calculated directly from the height and weight. So if I were to change the weight, you can see that the BMI changes as well, and I'll show you that. So if I change this patient's weight to 252, you'll see that the BMI changes as well. The next subform, let me scroll down, is the allergy subform. And it contains fields for allergies and reactions to the allergen. The next subform is a prescription subform, and these are prescriptions written in our clinic, and there are fields for all the required data needed for a prescription. Finally, we included a home medication subform to capture any medications that were not prescribed by our clinic. There are also fields to document patient compliance and provider notes. Now I'll scroll back up and we'll go over the clinical decision support alerts. So we've actually included 10 clinical decision support alert in our database. The first 5 were the ones Dr. Campbell used in his demo video. We thought these were important and wanted to include them in ours. So we added 5 additional ones. The first one alerts the provider that the patient is over 50 and should consider providing a flu vaccine. Our second alert is very similar in that it alerts the provider that the patient is over 65 and that a pneumonia vaccine might be appropriate for this patient. You can see both of those alerts on this first patient, and you'll see those right here. Our third alert is specific to women over 65 and reminds the provider to order a bone density test to screen for osteoporosis. And let me jump to patient 11 and check alerts, and you'll see that alert here, patient needs a bone density test to screen for osteoporosis. The fourth alert that we added, or the additional alert that we added, is that it reminds the provider that the patient is an active smoker and prompts him to offer smoking cessation literature and possibly even a prescription. So we'll go to this patient and check alerts. Oh. There we go. And you'll see offer smoking cessation literature and prescription. The final additional alert that we added lets the provider know that the patient is over the limit of a healthy BMI of 30, and it prompts him to offer nutritional and exercise advice and literature. And you can also see that alert on this patient, offer nutritional and exercise literature and counseling. And those are the CDSs that we have added. Thank you for your time.